Welcome to Psychology 635, Psychological Counseling, Interviewing, and Report Writing. I'm Dr. Douglas, and I'll be your professor this semester. Now, Sci 635 really is one of my favorite courses to teach, and that's because this is where you'll be introduced to your basic counseling skills. Things like how to make a client feel listened to, how to convey empathy, how to conduct a thorough clinical interview and get the information you need from a client without making the client feel interrogated. So this is where you'll learn the very basic skills required to be a mental health professional. And here we have my contact information. You can always email me and I'll get back to you within 48 hours. Typically, it's much faster than that, but 48 hours at the most. You can also give me a call, but I am not in my office. I'm still working remotely. So I won't be there to answer the phone when you call me. Instead, I'm sent an email containing your voice message. And once I get that email, I will return your call. You can always meet with me for office hours each Tuesday from 12 to 2 p.m. Those are virtual office hours, and you can find that by clicking on office hours in the Blackboard menu. Okay, required materials for the course. You will need our textbook, Interviewing and Change Strategies for Helpers. Um, Often students like to, get the semester-long ebook subscription or just rent the textbook for the semester, and that's fine. But also remember that you will most likely need to refer back to some of your textbooks to prepare for your comprehensive exam that will come later on in the program. So just know that if you do a temporary subscription or a rental of the book, you may have to do that again when it comes time to prepare for comps. Um, Also, this is a Cengage textbook, which means that it's a part of the um, Cengage subscription program. So that program allows you to get access to all of your Cengage ebooks for one price. So if you're also enrolled in the theories class, we're using the Cengage textbook for that class as well. So it would make sense to get that subscription if only to have access to the ebooks for those two classes. And that's the Cengage Unlimited program. You will also need to have access to the APA Ethics Code, so the Ethical Principles of Psychologists and Code of Conduct of the American Psychological Association. So you can find that on their website at apa.org/ethics/code. I also recommend that you purchase the APA Publication Manual, the 7th edition. And so, it's worth it to go ahead and purchase this. You'll use it throughout your career in this program. And so we will format our papers according to the, the procedures outlined in the APA Publication Manual. I would also recommend that you get access to a copy of the DSM-5. This is our diagnostic manual that we will use for our intake interview and our treatment plan. So for your treatment plan, you will definitely have to do a diagnosis. For your intake interview, if your client meets the diagnostic criteria for a disorder, you will have to make a diagnosis. So you'll need that for at least one of your assignments, possibly two of your assignments. Okay, the format of the class. This class is synchronous, meaning that we'll meet each Wednesday from 5:30 to 8. Outside of class, you will need to read the assigned chapters and view the mini lectures on your own schedule. So each week in the course content section of Blackboard, I'll post a weekly folder. That folder will have your mini lectures and any other supplemental material for the week. View those lectures, read the material before coming into class on Wednesday, and in class, we'll go into deeper discussion of the topics covered in the textbook and the mini lecture, and also we'll be practicing our counseling techniques. So that does mean that when you're practicing your counseling techniques with a small group or with a partner, you will need to turn on your camera. So we'll be splitting off into separate rooms to breakout rooms and practicing those skills. So you do need to be prepared to turn on your camera during those times. So our assignments in this course, how is your grade determined? First of all, we'll have a final exam. It will be worth 200 points and it will be comprehensive. The exam will include 50 multiple choice questions and 2 essay questions, and it will be taken through Blackboard. And now, the reason that we only have one exam in this course is that the skills that we're learning don't really lend themselves to a multiple choice exam. Again, we're talking about conveying empathy, how to interview clients, and how to maintain relationships, how to make a client feel listened to. So these are things that don't really transform well into multiple choice questions. So we're going to just have one exam in the class. So 50 multiple choice, 2 essay questions. We'll have a listening skills video. And this will be a role play of about 10 to 15 minutes in which you'll be the therapist and you'll have a mock client. And you're going to be practicing the listening skills we discussed, things like clarification, paraphrasing, reflection, and summarization, as well as your nonverbal communication. So if you have someone inside your bubble, somebody with whom you already have social contact, you can record this video in person. And that's what I prefer. I certainly don't want you going out and having contact with somebody you don't normally have contact with. But if you have, a roommate, somebody in your family that you can have be your mock client, then you can use them and record the video in person. If that's not an option for you, you can also use Zoom or some other type of video conferencing platform and record the session using that. So you'll have your person be a mock client, have them, come up with some scenario, some identity, something they're discussing with you. You're going to be the therapist. You're going to use these listening skills with your mock client, and then you record it and you'll send it to me either by email or through a link to some type of cloud service. Typically, it's better to use a cloud service as opposed to email because often these videos are too large to send as an attachment. Things like, a link to Google Drive, a link to Dropbox, those things typically work better than sending them via email. Okay, your next assignment will be your mental status exam, intake interview, and history. This is worth 200 points. Your listening skills videos worth 200 points, and your final exam is also worth 200 points. So with the mental status exam, intake interview, and history, here you will conduct a mental status exam, intake interview, and history taking interview with a mock client. So again, if there's somebody inside your bubble that you can do this with, do that and do it in person. If not, it could be somebody outside and you do the interview using some type of video conferencing. So you're going to perform an interview with this mock client. You're going to collect all the information you need from the client during your interview, and then you're going to write up your findings. So here you do have to actually perform the interview, but you're not recording it and turning it in. The product that you'll turn in will be your written report based upon the information you collected during the interview. So the things that the report should contain will be the client's quote unquote client, because this is not a real client with real issues. And that's another thing. Make sure that when you're enlisting the help of your mock client, they know that you're just practicing your skills, that you're not really providing them with any type of mental health intervention. They shouldn't really be talking to you about any serious personal issues they have. It should just be them pretending to be a client for the sake of practicing your skills. So the report that you turn in will contain the quote unquote client's identifying information, their presenting concerns, the results of your mental status exam, your behavioral observations. So what is their demeanor like? What is their mood like? How are their movements? So things that you observe during the course of conducting the interview. We'll talk about their psychiatric and counseling history or suicidal ideation, their educational and job history, their medical history, social developmental history, family, relationship, and sexual history, and a history of substance use, their legal history, military history, and a DSM-5 diagnosis if that's necessary, if they do meet the criteria for a DSM disorder. And so make sure that when you're writing your paper, your report, that you address each of these areas. So let's say you ask them about their military history, they have none. Don't just omit that from your report. Make sure that you state that client reported no military history. And of course, we'll talk much more in depth about these things before these assignments are due. Your final assignment worth 300 points will be your treatment plan. Here you'll be given a short vignette about a client. So you're not seeking out your own client. I'm going to give you a description of a client, and you will develop a treatment plan for that client. Your plan will include your referral source and reason for referral, their presenting complaint, meaning what brought them in for therapy, and any additional concerns that this client might have. You'll talk about the client's strengths and resources, things that could help them do well in therapy, client liabilities and potential barriers to treatment, so things that may make them have a difficult time making the changes they're trying to make. You'll make a DSM-5 diagnosis, and this client will meet the criteria for a diagnosis. So this is where you'll use that DSM. You'll develop treatment goals with the client. You'll talk about the treatment methods, helper interventions, meaning what you'll do, client implementations, meaning what the client will be responsible for, referral for evaluations. So if you feel like there's any additional information you need about the client that you can't get yourself, you can refer them out for further evaluations. We'll address the length, duration, and frequency of the treatment, the criteria for treatment termination or transfer. So what do you have to see from the client that will let you know that it's time to end therapy or possibly time to transfer that client to another therapist? You'll talk about the treatment plan review date, and you'll come back and kind of assess your progress towards your goals. Prognosis, meaning what is your outlook for the client? How well do you expect them to do trying to change their behavior or address their issue? And responsible staff, meaning who is responsible for carrying out each step of that treatment plan. Again, this is a vignette I'm going to give you, and what you're going to turn in is a written treatment plan based upon the description of the client in that vignette. All these assignments, with the exception of the listening skills video, will be submitted through Blackboard. Again, with the listening skills, either email it to me or preferably just email me a link to where I can go and view your listening skills video. Another point about these assignments, I highly, strongly encourage you to meet with me during office hours to discuss these assignments before you turn them in. So as I get closer, we will have sign up times to come and discuss them with me during office hours. So I suggest that, by the time it's time for you to meet with me to discuss them, you have a draft that I can look at. We can discuss any, shortcomings, any areas for improvement, the things you're doing well, so that once you turn in your final version of the assignment, you're happy with the finished product. I've given you feedback. And so this prevents us from, turning in assignments, getting low grades, and then students wanting to redo the assignment. So rather than have you redo the assignment after it's been turned in and graded, what I recommend is come in, meet with me during office hours. I'll give you your feedback then. And then once you turn in the assignment, that will be your final product, and that grade will stand. Oh, now this is your final assignment. I think I said final on the last one. But your final assignment will be your 2 reflection papers. So 2 papers worth 50 points each. So after completing the listening skills video and the intake interview, you will write a short paper reflecting on the experience of working with your mock clients. And when I say short paper, this can really just be, a paragraph or a couple of paragraphs. It's just reflecting on the experience of working with a quote unquote client. So I would like you to address in these reflection papers, what concerns did you have before working with your mock client? Did you feel confident? Did you feel nervous? How was the experience of working with the mock client? What did you feel that you did well when working with the client? And what areas do you see in which you need to improve? And what lessons did you learn from the experience that will help you work more effectively with real clients in the future? So in order to make this a meaningful exercise, I want you to make those mock sessions, your listening skills video, and your intake interview as realistic as possible. So, even if it's a close friend, try not to giggle and laugh and kind of break character. Try to pretend that you're with a real client and be in touch with your feelings about that. And so when you come to this reflection paper, you can really say, what did I get from this experience that will help me understand how I might react to a real client, and how can this benefit me and help me improve my interaction with real clients. Okay, our grade distribution, and I apologize for how some of these titles are breaking up on the side. It looks different when I was outside of Blackboard. Okay, so your grade distribution. Your final exam will be worth 200 points. Your listening skills video, 200 points. Your mental status exam, intake interview, and history will be 200 points. Your treatment plan, 300 points. And your reflection papers, there'll be 2 papers worth 50 points each, bringing that to 100 points. So your total for the course will be 1,000 possible points. So important dates. On Wednesday, February 24th, you have your listening skills video and the reflection paper for that video. On March 24th, a Wednesday, you'll have your mental status exam, intake interview, and history due, along with the reflection paper too for that. On Wednesday, April 14th, you will have your treatment plan due, and on Wednesday, May 5th, you have your final exam on chapters 1 through 14. So note that all of your due dates are on Wednesdays, and all of these are due at 11:59 p.m. on that due date. So the attendance policy. You must attend our virtual classes each Wednesday. Please notify me ahead of time if you will not be able to make class for that day. And because we'll be practicing our counseling skills, there will be times when you're required to turn your camera on. I know that can be kind of inconvenient, but just know that it's necessary in order for us to practice these skills. As far as turning in assignments late assignments are not accepted without a doctor's note or other documentation. So if you see a doctor, I'll need to see that note. If you're sick and you don't go to the doctor, I want you to write out a statement of, you know, why you were not able to turn your assignment in on time. So I have some documentation for the reason for why you couldn't turn that assignment in on time. And whenever possible, let me know ahead of time. If you see the date approaching and you know that you're sick, or you know that there's been some, death in the family or something like that, let me know ahead of time that you're not going to be able to turn the paper in, as opposed to waiting until after the due date passes and then saying, well, this is what was going on. This is why I couldn't turn in the paper. So let me know ahead of time if at all possible. Students who may need accommodations are asked to contact the Student Accessibility Service Office, the SASO office, and they will send me an email notifying me of the accommodations that you need for the course. So that is it for our introduction to Psychology 635. Hopefully that gave you a good understanding of the expectations for the course. If you have any other questions, don't hesitate to give me a call, send me an email, or see me in office hours. So thanks, and I hope you all have a good, safe, healthy semester.